Have you ever left a doctor's appointment feeling, well, a little lost? You get a diagnosis, but when it comes to what you should actually be eating, the advice is vague. Today, we're diving into that huge gap between medical advice and real, practical nutrition. I bet this sounds familiar. Your doctor tells you that you need to eat healthier to manage your blood pressure or diabetes. But what does that really mean? What should you buy at the grocery store? What's for dinner tonight? It's this exact disconnect that leaves so many of us feeling confused and unsupported. So why does this happen? Why is there such a massive gap in our healthcare system when it comes to food? Well, let's get into it. The problem really starts at the very beginning in how our medical professionals are trained. And this right here is the heart of the issue. It's actually pretty shocking. In the US, medical students get, on average, less than 20 hours of nutrition education. That's less than 1% of their total instruction time. They become experts in diseases and medications, but not in the practical day-to-day dietary guidance that patients desperately need. So this creates a system with two totally separate experts. On one hand, you have your physician. They are brilliant at figuring out what's wrong and prescribing the right medicine. On the other hand, you have a registered dietitian who is an expert in the how to build a meal plan, how to change your habits. And guess who gets stuck right in the middle? The patient. But what if we could close that gap? What if there was a way to bring those two worlds together? This brings us to a really innovative solution that's totally changing the game for patient care. Let me introduce you to Dr. Sumaiya Petiwala. She is the perfect example of this integrated solution in action. See, she's not just a qualified physician, and she's not just a registered dietitian. She's both. She has this completely unique skill set that allows her to connect the medical diagnosis directly to the dietary plan. And this is what she calls the 360-degree approach. It's not about just treating a symptom with a pill or handing you a generic diet sheet. No, this is about looking at the whole person, your medical history, your diagnosis, your lifestyle, and creating a truly personalized plan that gets to the root cause of the problem. Okay, so that all sounds fantastic, right? But what does this actually look like for a patient who walks through the door needing help? Let's break it down. The whole process is actually designed to be incredibly simple and accessible. It all starts with a detailed patient history form so they can understand everything about you. That's followed by an initial assessment, and from there, your completely personalized journey begins. And one of the most important parts of this whole approach is that it has to be practical. It has to fit into your real life. Just listen to what one patient, Hina Sheikh, said. The plan used ingredients she already had at home. That's the key to making changes that actually stick. So, what's the secret sauce here? This slide really lays it all out. It works because it's not some crazy restrictive starvation diet. It's about making sustainable lifestyle changes that treat the root cause, not just the symptoms. And everything is tailored specifically to your body and your goals. Now, a great philosophy is one thing, but does this actually work in the real world for a lot of people? Let's take a look at the proof, because the results are pretty incredible. The impact is just massive. Over the last 16 years, Dr. Petiwala's practice has helped guide more than 80,000 patient transformations. That's not just a handful of success stories. It proves that this integrated model can make a huge difference at scale. And what's even more telling is how people feel about the process. A 99% patient satisfaction rate, that's almost unheard of. It just goes to show that when people feel understood and get a plan that truly works for them, the results speak for themselves. And the benefits go way beyond just weight loss or managing a condition. Testimonials like this one from Suha Mariam are so powerful. She talks about her skin glowing and how easy the meals are. It's about total well-being, which is what happens when you truly nourish your body from the inside out. Okay, so at this point, you might be wondering, how can I get this kind of care for myself? Let's walk through the different ways you can get started on your own journey. The services are usually structured in a few different tiers to fit what you need. You could do a single consultation just to get a personalized plan and a quick kickstart. Or for ongoing support with things like weight loss or diabetes, there are monthly packages. And for more complex health goals, there are even more specialized diet plans available. For anyone who's ready to take that next step with Dr. Petiwala's practice, getting started is really simple. You can head straight to the website to fill out a form or just call or WhatsApp the number on your screen. So we'll leave you with this one question to think about. What could a truly integrated health plan, one that finally connects your medical diagnoses to the food on your plate, what could that unlock for you?